Okay, everyone. First of all, I want to welcome you to our Lehigh Valley Aging in Place virtual education seminar. My name is Kim Garrison, and I am the chair of the Education Committee. I work with a wonderful group of professionals that are very devoted to making sure that we continue and propel forward as we have to meet in different ways to continue to educate the public. So our organization is made up of professionals from the private, public, nonprofit, and business sector. And we're all committed to serving seniors. Sorry, I want to admit people as they're coming in so they don't miss anything. Our comprehensive resource guide is found on our website. So we want to encourage you to please make sure that you take the time to go back and look at that as a resource for you as you move forward and any services that you may need to support your loved one. Tonight, 5 of our outstanding members have agreed to be our care panel and part of the discussion. We recognize that after the holidays and seeing your loved ones, that you may need additional resources to keep them safe. Each of our care panels will do a brief introduction, and we will then begin our discussion. If you have any questions, please feel free to type them in the chat, which is being monitored by Jessica. We also encourage that if you would like a personal invitation to our next education seminar, that you take a moment, again in the chat, Brian has put his information on there. If you add your email address to that, then we will make sure that we send you a personal invitation moving forward to any of our educations. I promise you, you won't be spammed or anything. Okay, so let's begin. Our first introduction will be done by Fox Rehabilitation.
Hello, everybody. My name is Morgan. I am one of the account managers with Fox Rehabilitation. I cover the accounts. Fox Rehabilitation is a local outpatient therapy practice, and we specialize in geriatric care. And we perform our physical, occupational, and speech therapy services in homes or senior living communities of our patients. Tonight, joining me is our director of physical therapy, Samantha Deal, for any clinical questions that may come up. And just a quick note about our services. We are not a home office, but we are not an agency that requires our patients to be or to have what's called a face-to-face encounter, which we go into. Our services are accessible through insurance and through a prescription from your doctor. So I am happy to answer any questions that come up about our services or what makes us different. Thank you for having me.
Great, Morgan. And I know Maureen's on here also. She may want to jump in because you're going in and out with your volume, just so you know. I don't know if there's anything you can do on your end. And I'm not the only person here, like hearing her, right? Like having trouble hearing her.
Oh,
okay.
Sorry about that.
That's okay. That's
yeah,
all right.
Morgan, I think it's your mic, but Samantha's here and on camera, so we'll let Samantha take it.
Okay.
I'll take my headphones off.
You like that?
Okay, next is Meals on Wheels of the Greater Lehigh Valley.
Thank you for everybody for joining us. I'm Monica McCandless, Director of Client Services for Meals on Wheels of the Greater Lehigh Valley. We are a meals service. Our service area is the whole Lehigh Valley, which encompasses Northampton County, Lehigh County, and we just acquired part of Carbon County, that southern tier in Carbon County we'll deliver meals to. People who qualify for our service are homebound or disabled, recovering from surgery or an illness. Meal services could be short-term, long-term, just depending on a client's need. Clients who are eligible are also between the ages of 18 on up. There's always a fallacy that Meals on Wheels is just for the elderly, but it's also for our younger clientele also. The types of meals that we can provide you with a hot meal. We can provide you with a hot meal and a cold dinner sandwich pack. We have weekly frozen meals that we can provide to clients, and depending on a client's needs, we can provide you 5 to 10 to 14 meals, depending on your needs. Weekend meals are also available because our service is closed, our facility is closed on the weekends, so we do provide frozen weekend meals to clients who are in need of weekend meals. All our meals are cardiac and diabetic friendly across the board. We have medically tailored meals that are available, such as soft, pureed, lactose intolerant, and renal. We have 52 diet restrictions that a client can choose from. The cost can range anywhere from $6.50 to $10.50 per meal, just depending on where you would fall on our sliding scale. We do need to complete an income worksheet with the client to determine your cost of the meal. At times, there are county funding available through Northampton County and Lehigh County, not Carbon County, unfortunately, but that is determined by the county. They determine if a client is eligible for any type of subsidized for their meals. Additional services available through Meals on Wheels is our Chef Pack program. So if you're up and about in the community and you don't want to be homebound yet, you're not ready to be homebound, don't want to be homebound, we have our Chef Pack program where they're frozen meals for our clients to choose from. And we also have a grocery shopping service in certain areas. We do have a little bit of a volunteer shortage in that area. So depending where you live, there may be some grocery shopping services available for you. If you have any questions, please feel free to reach out to me. Thank you.
Awesome, Monica, thank you. Next, we'll go to Lehigh County Veteran Affairs.
Thanks, Kim, and thanks for everyone doing this, and thanks to our audience for joining in. My name is Tom Applebach. I'm the Director of Veterans Affairs for Lehigh County, but the things that I'll talk about apply to any county in Pennsylvania and practically nationwide, so please don't think Lehigh County only. Our main goal is to serve our veterans and their surviving spouses with whatever needs that they have. One of the biggest programs that we assist our veterans and surviving spouses with is what's called the VA pension, or the VA pension with aid and attendance program. That is available only to veterans who served during a period of war. You didn't have to be in combat, but served during that period of war. And if eligible, there's income requirements and so forth. But if eligible, that can provide additional money that can help to pay for in-home care providers for our care providers out there, or also if you are in a senior living, assisted living environment, that can provide additional funding that can really oftentimes make the difference between being able to pay that monthly bill or not. And it's a great program. There's a lot of other requirements. Of course, it's a federal program. And at the end of this, at some point, I'll give you my phone number, and please don't hesitate to call. And if you have questions about that. But we also provide a variety of other services to veterans and their families. One of the other big programs is what's called veterans compensation. That's for injuries and illness incurred while on active duty. And believe it or not, we still do claims and have them come in, and assist veterans from World War II and even Korea with those claims. And that can provide additional income to those families. We provide a lot of other services. We try to connect people with everything from getting their military discharge papers, which is probably the one paper that your father lost when he came, back from Korea, all the way up to trying to, hooking people up with homeless services, our homeless veterans and other veterans in various situations. We are always a phone call away. If we can't help you, we will try to get you where you need to be and make contact with those folks. Above all, that's our mission, is to help our veterans and families as best as we can. Just a quick background on me. I am a veteran, retired actually, military of the Air Force and the Army. I couldn't get enough of one, so I had to serve in both of them. But this job really brings me a lot of satisfaction because I continue to work with my brothers and sisters and their families to help them with what they need. Thank you very much.
Tom, thank you. And thank you for your service. I want to remind each speaker, if you could please put your contact information in the chat. That way, anybody who wants to reach out to you has that ability to be able to do that. You can also find each one of our speakers' contact information and a little bit more about them also on our LVIP website on our resource guide. Next is going to be Care Patrol.
Good evening, everyone. Mary Ann Piquel with Care Patrol of the Lehigh Valley and Upper Bucks Territory. And I am a certified senior advisor. And so I help families when they're going down that path of looking for safe, quality senior care options, whether in-home care, assisted living, memory care, or adult day programs. We help families through that process by meeting with them, getting to know a little bit more about their older adult loved one that they're trying to help find those options for care. We meet with them, we discuss how they're handling their activities of daily living, what their health is like, and of course, what their finances are like, because all of those options are private pay. So after that discussion, we then help find the right care at an affordable cost for them, and our service is at no cost to you. So Care Patrol of the Lehigh Valley and Upper Bucks, and I'll have my contact information in the chat if you'd like to chat with me. Thank you.
Thanks, Mary Ann. Next, healthcare advocate, Melissa.
Hi, everybody. Thanks, Kim, for organizing this. My name is Dr. Melissa Hakim, and I'm a physician turned health advocate. I started my business in 2015. It's called Hakim Health Partners, when I noticed that people are really struggling managing their healthcare. The healthcare system has changed, as we all know, and it sometimes feels as if we as patients are just cogs in the wheel. So what I do is I focus solely on advocacy work, making sure people are in control of their health. But what does that mean? Some of the services I provide are I go with my clients to their appointments and make sure that they and their healthcare providers understand their individual needs. I send summaries to family members, if desired, so that everyone is on the same page about mom and dad's health, and there's no game of whisper down the valley. I check in on my clients to make sure they are following their doctor's orders in between appointments. I coordinate care with the various specialists. I get second opinions and make sure they are receiving the best possible health care. If my clients are hospitalized, I talk with the medical staff and make sure they are getting the appropriate care, and I'm constantly on their portals finding out what is going on. Upon discharge, I make sure that the treatment plan is being followed and that the appropriate services are set up in the home to allow for a safe discharge. So basically, I'm an extra set of eyes on my clients' medical situations, and my services are individually tailored to my clients' needs. My senior clients tell me I reduce their stress and their family stress when it comes to their health needs. And I'll put my contact info in the chat.
Awesome. Thank you. So I thought I'd start with some questions because I don't believe there's any in the chat at this point, right, Jess? Nothing yet, right? Okay, so feel free if anybody has any questions to please put them in the chat. So I thought I'd start off with Morgan. Morgan, can you share like how the services are paid and what makes you different than maybe a visiting nurse association or home health?
Yes. Can you hear me better this time?
Much better. Thank you.
Okay, perfect. Yes, sorry about that.
That's okay.
So we provide therapy, physical, occupational, and speech therapy services through a patient's insurance. We also offer private pay for very specific scenarios where something like that might come into play if an insurance doesn't cover our services, or if a patient wants ongoing types of therapy that might not be covered by insurance. But we bill as an outpatient provider. So just like if a patient were to go to a clinic or a gym for physical therapy services or even OT or speech, we bill similar. And what makes us different from any other agency that comes into a private home to provide services is that we are that true outpatient level. Here in the Lehigh Valley, a majority of the providers that are able to go into a patient's home to provide therapy services, they fall under what is known as a home health care agency or a Part A benefit of their insurance. And what that means is just a different level of therapy. We are seeing our patients 2 to 3 times a week on average per discipline. And those visits last for about an hour at a time and focus on high-level goals set by patients and their families at the initial evaluation that we complete. I hope that opened up room for any more questions anybody might have.
That's awesome. Thank you so much.
Mhm.
Mary Ann, what does a senior care advisor do?
So a certified senior advisor is that we have done a course of study that looks into the many difficult challenges that older adults face as they're going through the journey of aging. So our disciplines are learning more about the different disease processes that will affect older adults, as well as the different levels of care. And we also are bound by our code of ethics as well. So when we are helping our families, it really is all about trying to help them find the solutions for the best levels of care for that individual.
Thank you. Meals on Wheels, Monica. How long does it take for services to start? And you had mentioned briefly like the charges for that. What if someone is like low income and can't afford? Is there options as well to support them?
There is. If a client is low income or they don't have the family support, we then refer the clients to either Northampton County Area Agency on Aging or Lehigh County Area Aging, depending on the area they live in. And I'm sorry, what was the first part of the question?
Like if someone needed services, how long would it take for something like that to happen?
From the
Like
time
what's that process look like? How does that deciding factor happen?
So once we get the referral into Meals on Wheels, one of the client services representatives will take the referral, or we get them via fax, or some people mail them in even, believe it or not. And we will contact the client, complete the application, and then refer them to our case managers. Once our case manager completes an income worksheet with the client and gets a 2-week payment up front for the meals, it usually takes 2 to 3 working days to get a client started. So it's fairly quick once the client, the application and everything is processed.
So if someone's coming home from the hospital or something like that, pretty quickly, you guys could get them supported on services.
Correct. And we can emergency start a client if the client doesn't have anybody in the community, or they just are lacking food in their home. We can emergency start a client to get services in there quickly.
It's good to know. Absolutely.
So Kim, I just have a real quick question for Monica, if that's okay. And then I
Sure.
think we have one to go back to Marianne. I think it was for Care Patrol. But Monica, just real quick, you had mentioned something about Meals on Wheels, and I think traditionally we think that's for the elderly, but you had mentioned something in your intro that you do also serve a younger population. So I was just curious a little bit about that.
Yes, we serve clients 18 years and up. So whether you're disabled, born that way, or whether, let's say we had a client that was expecting, she could not get out of bed, she had to be bed bound, resting. We supplied meals to her until she was able to get up and get about. We've serviced clients with surgeries, knee surgeries, elbow surgeries, recuperating from the hospital, just depending on your need. But we do have many clients that are from the age 18 and up. It's no longer just for the elderly. We are here to help you remain in your home. That's what we're here for.
Almost 20 years in healthcare, and I didn't realize that. I actually only thought it was elderly. So that's a great insight tonight for me. Thank you.
You're welcome.
But also, I don't know, Kim, if you want to revert back, there was a question. I think it was for Care Patrol, or how, if you want to wait until if there's any more questions for Monica.
Yeah, no, go ahead. Absolutely.
A question came through the chat. It says, when families are reaching out for help, is there a general theme to the need for help? Are they in crisis and in immediate help? So I think it was for Marianne, like what types of families are really reaching out to you? Are they in crisis mode? Are they planning ahead? Like, how are you dealing with these families?
Yeah, that's a great question, Jessica. So we help both levels of care. So when somebody's in crisis, we can really kick in very quickly to help someone get placed in an immediate need. But I do encourage families to please try to plan ahead. So as we're all aging, it's good for us all to think about what that looks like, what we would like to do in the future for where we would like to live as a senior and think about our healthcare and what that's going to cost in the future. So if I can encourage anyone, if you're getting to that point, either yourself or you have older adults in your life that maybe have not thought about that, it's good to think ahead. And we're open to meeting with you at any point in that journey of aging to help guide you through that process.
Thank
Thank
you.
Marianne.
Melissa, how does your services lessen the stress for seniors and their family members?
Well, one, it lessens, let's just deal with the seniors. So the senior now has a partner and they have someone to go to the appointments. They're not going by themselves. I don't drive my clients, but I meet them at the door. We go together. People are stressed when they're at the doctors. That's just in general. And when people are stressed, there was a study that came out that said 80% of older adults and people who have some sort of anxiety in the doctors are going to forget what was said in the doctor's office. Some they're taking notes. They're talking to the doctor. They're talking to the other specialists. I'm coordinating care. I'm reminding seniors afterwards, like this is what was discussed. We talk about it afterwards. I'll call the following day to make sure they, that they switch the medication, that they're only taking the half a pill or whatever it is. So it lessens it for them. And now they have someone they can turn to say, this is going on, but they don't have to go through the whole story. So that's how it lessens it for the clients, and how it lessens for their families is they're now not juggling everything. And they have now a professional really managing their healthcare. So when I go with my client to the doctor, I will send out an email to all the family members. This is what's going on. This is who we saw. This is what was discussed. This is the plan. And now everybody's on the same page. So they're not reaching back to like mom to say, what did the doctor say? And then she'll be like, I don't know. So it keeps everyone in the loop. And it's the same thing for them. They have someone that they could turn to who knows their parent's situation and could then act on it.
That's awesome. I would imagine that with people being so far away, with us living very different communities, when we were, I don't know, when I was a child, we all lived in the same area, and now it's different. People live in different parts of the country. And so being able to, I couldn't even imagine trying to be able to manage medical things for my parents if they didn't live where I did. So,
but you know what I found too, like that's what I thought as well. But now as I'm doing it for 6 years, there's a lot of seniors who do not want their children managing their healthcare or to be the focus of their conversation with their children, like this is going on with their health. So I have a lot of seniors who are like, I want someone else to do it. I want my daughter to be my daughter. So it's a mixed bag.
I never thought about that, but that's
and
great.
I stress to my seniors who are at home, aging in place, that it gives them independence. My services give them independence because they're now not relying on a family member to have to do everything.
Kim, I have a quick question for Dr. Hakim. Are you affiliated with any kind of hospital network, or are you an independent provider who is free of that?
So I am totally independent. I am not practicing medicine at this point. I solely do advocacy work. So I do not act as my client's doctor. I act as their health advocate. So I'll review their medical information, but I am not the one making changes. I'll say, hey, let's talk to your doctor about switching this medicine. So what you said is an important thing, because there are health advocates that work for the health network. Their main allegiance is to the health network, and independent health advocates' main allegiance to their client. So
very important. Very good.
Awesome.
Thank you.
Tom, what are some of the other things that your office focuses on in regards to veterans and the benefits?
Well, I spoke about a lot of it before, and maybe I can be succinct without being crass, but we have a kind of a running joke in the office. Every phone call is a new adventure. And what we mean by that is we never know what we're going to get. But our goal, of course, is to serve the veterans or their families, or to get them where they need to be. Oftentimes, they're calling us, and it's not something, I hate to say that we do, but we can get them to the appropriate office give them some information, but get them to the appropriate agency or office that can provide those services. Or perhaps they don't qualify for specific federal or state veterans programs, but we can coordinate with our Department of Aging and Adult Services to get them connected that direction. So we look at ourselves as someone who assists veterans, but also somewhat of a clearinghouse, if you will. I think the bottom line is do not hesitate to call my office or your county office of Veterans Affairs and ask the question, because if it doesn't get asked, then you'll never move forward with that. I'll also add that we work closely with our home care providers, our senior living facilities, so that we can make sure we get those the veterans, and I can't emphasize it enough, surviving spouses, the benefits that they've earned. So don't hesitate to reach out, because we don't want anyone to miss out on a program. If I could, Kim, I just want to jump real fast here, and I'm going to put Monica on the spot, but I'm going to throw her a real quick softball question, because I saw the weather forecast for the weekend. It looks like snow. So what happens when there's a blizzard, hint, hint, and Meals on Wheels? How do you handle that?
Thank you, Tom. Well, what happens is if it's, because we always keep in mind our volunteers. So if we do need to cancel meals, we have provided the clients with emergency frozen meals. So there should be enough that a client has in their residence for 3 days in order to get them through. Hopefully we are dug out in 3 days and that we're able to get back there delivering to our clients.
That's awesome. Awesome.
Thank you for that, Monica. I know there was a softball, but I wanted to make sure people were aware that services don't get cut just because the weather's bad. There's contingency. Thanks.
Yeah. Tom, is your service for free?
We never, I like to joke, and of course, Kim, me, I'll get myself in trouble one day, but there is no charge ever for our services. Although look, I do like a single malt scotch, but I didn't say that. But in all seriousness, there is no charge for our services or any of the government services. And as a matter of fact, it's illegal under federal law to charge to us, to charge to help someone apply for these services. There are some companies out there that have figured out workarounds and so forth. I'm not going to get down that road. What I would say, though, is to anyone out there, if there is if you're in need of financial advice, contact an elder law attorney or a senior financial advisor. They can talk to you about what you can and can't do, with your legacy, what's legal and illegal. But again, to apply for veterans claims through the state or federal services, there's never a charge. It's illegal to charge. We are more than glad to provide that service. And for what it's worth, your county dollars pay my salary. So that's your charge.
Hey, Tom, I have a question too as well. So you had mentioned about senior home care, and I'm really glad you mentioned it. A lot of vets don't realize sometimes that they have the benefit or they qualify for that. So I'm just curious, what's the best way? I work in the hospice world and we have a lot of veterans. Is there a way that we can all coordinate better? Should we reach out to you? Should we reach out to the Area Agency on Aging as mentioned, or what's the best way we can all connect?
The best way, especially if you've got someone who, and I always say use the word veteran, but it really should be someone who served in the military on active duty, or again, surviving spouses. And that's one of the keys that we miss sometimes. The best way to reach out is to call me. You don't necessarily have to have the veteran or family call me, so we can at least run through the basics and see what kind of eligibilities that we have. And then we can move forward from there. And I should say, this is the Lehigh Valley Aging in Place. So one of the things that we want to do is to help provide those dollars to pay for in-home care, if we can keep that person, in their home as long as possible, which is the ultimate goal. And I should also add, and I'm sure that many of the folks on this call, in Aging in Place members, we're doing an awful lot of things electronically. So we're passing documents back and forth to review, to put applications together for signature and so forth. So don't be afraid in the day of COVID that we can't get things done. We are getting things done, and we're figuring out how to make it work expeditiously for all of us, so that we can serve our clients the best that they can. So don't think that you have to come out, in COVID in 0-degree weather to meet with me when we can make it happen over the phone and via email. And I'm sure everybody else is going to shake their head and say, that's the way we're doing a lot of our work.
Thanks, Tom.
Awesome. Morgan, in regards to therapy, how long do they come out to your house to give you therapy normally?
That is a great question. So our plans of care are all individualized by our patients' requests and goals and functional needs. So our patients on average, and Samantha, you can chime in if I'm off by my number of days, but I would say on average, our patients receive probably about 70 days of therapy, just looking at all of the patients we serve throughout Lehigh and even Northampton County. That being said, there is no cookie cutter dosage and length of time that we're with a patient. It truly is specific to someone's needs. So if it's a quick recovery from a sprained shoulder, that's one thing. And if it's a patient that we are performing LSVT big or LSVT loud and transitioning into a different program after that, obviously their services are going to go a little bit longer. So depending on the needs, we'll tailor each program. And before you discharge or before a patient discharges, that is something that is extensively talked about. So there are home exercise plans in place, and there is a plan sort of for those services to almost end or taper down at the end, if you will, just so someone's not left hanging.
Awesome, wonderful. Mary Ann, in regards to your services, what are the different care levels that you can help people make a choice with?
Sure. So the care levels, of course, as Tom had mentioned, so many of our older adults would like to age in place at home. And so we can help start that process at home because we do partner with a lot of the other businesses on aging in place. One of them being Fox, of course. So if I have a client that I'm sitting with and we're discussing what's the safest way for us to stay at home right now, one of the first things I'm going to do is refer them to Fox to make sure that they're getting physical, occupational, or speech therapy in the home, keeping them safe and strong and be able to, stay there as safely as they can. And then, of course, we help them to look around the home, see what changes we can make in the home to make it the safest as possible. But next in line would be possibly bringing in some home care as well. And of course, part of our Aging in Place group, we have many different home care agencies that we work with, and we would next refer to some of those. And then from there, when home is probably no longer the best option because of the level of care that they are at, then we would help them look at perhaps looking at assisted living communities or even secure memory care communities, if those are the next step in line for the care levels that they need. Beyond that, if somebody is at a point where they need more care than is possible in either a personal care home or assisted living, we will discuss and help them to find an appropriate nursing home. So we go through all those different levels of care with them so that they have a very good understanding of them and help to transition them through whatever those care levels are.
Thank you, Mary Ann.
Thank you.
Hey, Kim, we have a question in the chat here. It's for Meals on Wheels. And the question is, can you explain how the delivery process looks like in the current COVID stage and person contact? Are meals left on the porch or where? How does that work?
So if a client notifies us that they have been tested positive for COVID, we have two options. One, we put the meal in a bag and we'll place it on the client's doorknob and the volunteer will knock on the door, or sometimes they put a table next to the door and we'll place the meal on there depending on what the client would want. Or sometimes they have codes that they'll provide us to go into their garage and they have a refrigerator or something in their garage or a table setting in there. And what we'll do then is we just ask the client, we tell the volunteers, go to your car, wait till they acknowledge, the client acknowledges you at the door. So we ask the client to go to the door and wave and say, hey, I'm here, I'm okay. And then the volunteer goes on their way. So just so we have that acknowledgement that I'm in the house, that I haven't fallen, I'm not down, I'm okay, and I've gotten my meal.
Yes, your volunteers really play an important part in a lot of roles here. So
Yes,
they are
our
very
volunteers are
valued.
wonderful. Yeah.
Melissa, I was wondering for your service, if I know recently in my own life, my parents have been in and out of the hospital and it becomes really challenging. And I'm just wondering, are you as well going into the hospitals to support your clients and their family members?
So I do it, everything is individually tailored to the client, what they would like. So for my clients, in the age of COVID now, right, if we're allowed in, when everything was locked down and no one was allowed in, I was not allowed in. But once they start allowing in visitors, I go in, I meet the nurses. I will talk to the hospitalist, and usually I'm the one, depending on the family situation, usually I'm the one the hospitalist will call and give me the daily update, and then I disseminate it to the family. Now I sign all my clients up for their individual portals, so I'm able to follow the notes that way. The one good thing about COVID is it showed us all that we could do things not necessarily always in person, then we're able to do it through the computer. So I have clients now throughout the country, and I'm doing the same thing where I'm not physically there, but I'm talking to the hospitalists, the doctors, the nurses. I'm on their portals and checking. So I think it's not equally, it's even more important just to have a set of eyes on the hospital stay, just because the primary care doctor is no longer the one following the patient, and they really know the patient. So it's good to have, and this is where another benefit is, someone who knows why the primary care doctor put them on a certain medicine and not another medicine, so we don't have to go through this trial and error. Because even though everything is in Epic and on the reports, there's not sometimes explanations of why things were done a certain way.
That's awesome.
So Melissa, I just have a question for you. If a family was interested in reaching out, because even my own personal life, you have family members that wind up in the hospital. And if you don't have somebody there truly as an advocate, we all know things can go in all different directions. And if you don't have somebody in the healthcare field, it can literally go in many directions. So how would somebody in the general public get in connection with someone like you? How can you help somebody? How can we contact you?
I put my contact information on there, and I would meet and talk to the, I get phone calls all the time, and some of them I could help, some are not, or I give some advice or something like that. But they would contact me, they could call me, send me an email, contact me through my website. And then we would have
I think you are a
conversation.
key piece in, especially during these times during COVID, when visitations are minimal, even in facilities, things like that. I think you are a key piece to the healthcare system. You really are.
And like, I'm going to say something like Monica said, like I started as a service for seniors, and I'm going to say my clients are about 50% seniors at this point, and from age 18 on up, people who want just someone to have an eye on what's going on. And it's not even COVID. It's like how the practice of medicine has changed. Now you have like hospitalists who are doing the internal medicine in the hospital, and they're great for that, but they don't know how the outpatient setting works. They don't know that, like, oh, just follow up in neuro, as an outpatient. I'm like, wait, they
is
can't
a
get in for
totally
6
different
months.
story. The appointment and the follow through,
Right.
It's not that easy. I guess.
So it's like making sure neuro has a consult while you're in the hospital, and then you're an established patient. So it's like these little things that the hospital list doesn't.
No, you're a great asset for a lot of families, I think.
Yeah.
And if we can connect them to you, I think it would be beneficial to everyone, really.
Yeah, no, I think it's a good service. I think everyone could use an extra set of eyes.
Absolutely.
Tom, I know a lot of families, when I meet with them, they always say, how long does it take to get the VA benefits for aid in attendance? Do you know what that's looking like at this point?
Believe it or not, the VA actually works pretty fast. It can take a little while to get the all the documents together for the application process. We kind of pride ourselves on making sure that the packet that we put together and submit electronically to the VA is complete and they can rate it, or it's ready to go. In general, the VA is taking about 4 to 6 weeks, but we have had decisions come back significantly faster than that, which surprises us. But one thing to bear in mind is that the VA uses, everything is predicated on what they call the date of claim, which in their language is the first day of the month following receipt of the claim. So if we submitted a claim today, February 1st would be the date of claim. No matter when they approve it, they pay back starting to that date of claim. So don't think, although you may need the money, don't think that the VA is gypping you out of 2 or 3 months of money. That will be an accrued benefit. So don't think you're losing money. But the VA, the pension management centers are actually working pretty efficiently. The VA has figured out how to work electronically. And most of their folks are working from home, but they're working very efficiently. I do want to throw out one thing that I forgot to mention for everybody here in the audience is I know I'm speaking directly to someone that's saying, a veteran or surviving spouse, but don't forget your neighbors and your friends who may have served in the military. And if you think that they could use, some veteran services, make sure you pass along my office number or the other counties or have them, contact those counties to have that brief discussion. Because again, we don't want somebody to miss out on their benefits. And also bear in mind, because here in Lehigh County and many other counties, we don't necessarily look at county lines. So if it's someone who lives in Fleetwood, for example, or Easton, I don't have a problem calling my office and having that discussion, but I may direct them to a closer county office. But don't think that you have to live in that specific county to get those questions answered. The last thing I want somebody to do is to not make that phone call. So thanks for the question, Kim. Good question. Thank you.
Awesome. Oh, I had another question. If someone needs their discharge papers, because that always is another thing, like people are like, I don't even have any idea where that DD 214 is. They look at you like, where am I going to get that? Is that something that your office can assist with as well?
The answer is I wish you hadn't asked that question.
Oh, sorry.
Because of COVID. No, that's fine. Actually, it's a very good question. In some instances, we may have, or your appropriate county may have a copy of it at the Veterans Affairs office. Or if you know where the person returned to when they left the military, way back in 1954 when they left, came back from Korea, they may have recorded that with the Recorder of Deeds office, but that's something the veteran would have had to do. But don't hesitate to try to do a little sleuthing and see if you can figure that out. Doesn't cost anything to make that phone call, nor does it cost anything for them to produce a certified copy of that. So those are several of the avenues. The downside is all of the archives are stored at the National Personnel Records Center in St. Louis, and because of COVID, they're extremely short-staffed. So when a request comes into them, someone has to go into the files and physically pull the paper and scan it. That said, you can make that request. My advice is go to a website called archives.gov, put that request in right now. And I'm not kidding you, it's taking 18 to 24 months to get that. Put that request in now in the off chance that you need it, in the future. So don't hesitate to put that request in. They're working as fast as they can. Congress has allocated additional money so they can bring in additional personnel, but it's just a lot of things are on paper. If the person has served in the military within the last 20 years and you can't find discharge papers, I may be able to access them electronically. But if it's someone from Korea or Vietnam, there's no way I can access them unless I physically have them in my system. So I hate the question, Kim, but it's a great
Sorry.
question. No,
Yeah.
because people should
Well, at
be
least people can be
accessing
proactive.
now.
Yeah.
Yeah, if you can't find
absolutely.
anything, go to archives.gov, put that request in, be patient, but get those documents now.
Mary Ann, in regards to your services, who pays for the, like, is it private pay? Is it covered by insurance in regards to like the levels of care that you're referring to?
Thank you, Kim, for that question. So our service to our clients is always free. Care Patrol is a nationwide company. We have about 150 offices nationwide, and we are contracted with all of the providers. That would be the services. So the home care agencies, the assisted living and the memory care communities, they are the ones that pay us to help the families travel down that path of finding the right care.
Okay, thank you. Morgan, if somebody,
Kim, can I just jump
yeah,
in quick?
sure. Sorry.
Mary Ann, would it be helpful if we could try to advocate to case managers in hospitals more, especially if it's a free service that's available to families that you're helping? Is
Oh,
it something that we can
absolutely.
try and help with? Because I can tell you, it's probably a very valued resource.
Oh my gosh, Jessica, absolutely. So Lupe Schuster, who is on the call with us today, she's our director of marketing, and definitely she does reach out to the case managers, the social workers in the hospitals, in the rehab centers. They are
Yes.
definitely the people that we are in touch with on a regular basis.
And I know there is a lot of turnover right now in the hospital case management team. I can tell you that. But yes, I think, you know, that was my past of 16 years. If I would have known what a resource Care Patrol was back then, I would have referred a million times. So I'm grateful for what you're doing, and I wish I would have known back then.
Thank you. Thank you. Jess. I appreciate that.
Yeah.
Morgan, if someone was interested, like they see that their loved one is, you know, getting weaker and thinks that they could benefit from some therapy at home, what does that process look like? Like, do they call their physician, or is that something they can reach out to you and then you take it from there?
Yep. So we respect everybody's process and their own healthcare journey. If there are family members or even a patient who is really the most comfortable with talking to their physician about the services, then that's absolutely the way to go. We require a prescription for our services from their physician. So an evaluate and treat order from the doctor has to come to us. They can fax or email it. All that information can be found on our website and through my contact information. But what I like to do personally, just having seen all of the different aspects of the healthcare system right now, is be that person for our potential patients. So a lot of times I'll spend time speaking with a daughter or a son or a caregiver of some sort to a patient who is struggling and really doesn't know, you know, what the next step is or what the appropriate PTOT speech or why we're coming would be. And what we end up at the end of that conversation with is usually a request from that person for me to reach out to the physician on their behalf to request the documents that we need for our evaluation. So I am more than happy to take that off of someone's plate if they're struggling with the communication or understanding what's needed.
Awesome. So I just want to remind everyone, if you want to be notified of the next education series, please make sure that you put your email address into Brian. He has his information listed in there. It will be kept confidential. And I thought if we could just end the evening with just going to each one of our speakers, if they want to add just something maybe we haven't touched on that they thought might be very important to close the night with. So Monica, would you like to start us off?
Sure. Yeah. If you just call our office, there's no obligation. Call our office, and if you have any questions, our client services representatives will be more than happy to answer it. There's no obligation. Just we could get you the information. You can find out a little bit more about our services and what we have to offer and how it can work for you.
Awesome. Thank you, Monica. Melissa?
Sure, I'm going to follow just what Monica said. If you have any questions and you think you might need an advocate or someone in your family may, or one of your clients, please don't hesitate to reach out to me. I could, we could work out a plan and individually tailor, my services to their needs.
Thank you. Tom?
Thanks, Kim. I think the only thing I would say, I know it went in the chat, but my office number is 610 for anyone who needs to write this down, 610-782-3295. You can speak to myself or anyone on my staff. They are more than capable to assist and answer the questions. And I can't emphasize enough that don't hesitate to make the phone call. I mean, I hate sometimes to be able to say or have to say you're not eligible, but I don't want someone missing out, especially when it comes to dollars that can help make a huge difference in the quality of life for our parents, our moms, our dads, our uncles, or even ourselves. So don't hesitate to ask that question. And I'll just throw this out. I've worked with Lehigh Valley Aging in Place for, I hate to say how many years now, Kim, but these folks at Aging in Place are, I know they're businesses and they're here to make money. I get that, but they are dedicated to helping our seniors to live a good quality of life and not to be neglected or forgotten. Maybe it's the way to say it. So these are really good folks. Please go on the website, pick up the guide, and work with those folks because they're here to help above all. So sorry for the pitch, but I'm really glad, I'm proud to be a member of the
We
organization.
appreciate the pitch. We've been working together a long time, Tom, so we do appreciate that. We appreciate you being part of our membership. Mary Ann.
So I would like to say the same, I think when somebody is hospitalized or we have a family member or a friend that's going through that journey of aging and they're not quite sure where to turn, because that is a very overwhelming, confusing, stressful time when someone in your family is hospitalized and they're going through that path and they don't really know where to turn. That's the perfect time to reach out to us because we can help them when they're hospitalized, moving on to rehab, and then ultimately finding that next level of care, whether it's bringing them home with home care or looking for assisted living or memory care. We'll help you through that journey until we find the right solution for you. So please know that you can call us. My number is 610-509-0445. I'm in the chat. And I have to also say the same, Lehigh Valley Aging in Place. I've been with that group for about 8 years now. I've been on that board. And this is just a very passionate group of individuals that really care about our older adult community. And I do implore you to reach out to any one of us and we will guide you through that process.
Thank you, Mary Ann. Morgan?
Man, those are tough acts to follow.
I know, I was just thinking that.
So for us, I think sort of the final closing idea of what Fox Rehabilitation can do is really to help anyone that needs it, right? We don't require patients have been in the hospital or have had this major life-changing event. It's really truly, how do we help our older adult patients achieve their functional goals? And for us, one of our primary patient types that we do see that we didn't really talk much about tonight are those older adults who are suffering from cognitive decline, dementia, memory loss, Alzheimer's. And we are able to treat specifically with those conditions in mind. All of our clinicians are trained from day one in special practices for those types of patients. And we are, I can probably safely say we are the only provider that does go into the home with speech therapy as a cognitive therapy. So it is a different level of care. It is something that we are very proud of and do work really hard on, especially with the caregiver education piece and the supportive piece of that as well. So like everyone else has said, please, if you get nothing else from this group of people in this care panel, don't hesitate to pick up the phone or go online and find one of us or someone on the LVAIP website and the member directory that could meet your needs, because chances are, if we're the wrong person, we'll find you the right one.
That's absolutely true. I couldn't say it any better, Morgan.
Yeah, well said.
Yeah, absolutely. So again, just a reminder that the directory is there. Our membership is very deep, but again, if there's something that's not there for you, we have a phone number that you can actually call for information. That number is 1-877-334-8942. Again, 1-877-334-8942. And you can also go and just click on for information too, if you need assistance and you're not finding what you need, and we will gladly help you in any way that we can. I want to thank all the speakers. It is just so phenomenal for you giving up your time this evening. We are so proud that you're part of Lehigh Valley Aging in Place and serving with us. I've been part of Aging in Place for many, many years, and every time we do one of these, I feel like a proud mama. So I'm so glad that we are going to continue to educate the community. Our education committee is devoted to doing that. So again, please don't hesitate to reach out to us if you'd like to be included. And I wish you all a good evening. Thank you.
Thanks, Kim.
Thank you.
Thank you,
Thank you,
everyone.
Kim.
Have a good night.